Hi everyone, this lesson is on natural supplements that can be used to treat hemorrhoidal disease or to reduce the signs and symptoms of hemorrhoids. Before we talk about those natural supplements, let's talk about what hemorrhoids and hemorrhoidal disease are. So hemorrhoids are these vascular cushions or tissues that aid in fecal continence. They are located in the anal canal and they're supported by a particular muscle known as Treitz muscle. So hemorrhoids are normal vascular cushions or tissues. But the problem is that they can have issues, and this is what we would call hemorrhoidal disease. And it is actually estimated that up to 3/4 of adults will suffer from hemorrhoidal disease at some point in their lives. So hemorrhoids, again, are normal, but when there are issues with these hemorrhoids that cause signs and symptoms, that would be what we would call hemorrhoidal disease. But throughout this lesson, I'm going to refer to hemorrhoids and hemorrhoidal disease interchangeably. So the signs and symptoms of hemorrhoidal disease are the following: bright red blood per rectum, or BRBPR, pain, itching, edema, prolapse, and thrombosis. So thrombosis would be a clot in the hemorrhoid itself. And there can be some other signs and symptoms as well. If you want more information, please check out my full lesson on the signs and symptoms of hemorrhoidal disease. So briefly, the normal treatments that are employed for hemorrhoidal disease include increased dietary fiber, exercise, and surgery. So surgery would be resigned to more severe cases. But the topic of this lesson is that there are a variety of natural supplements that have been demonstrated to have beneficial effects with reducing the signs and symptoms of hemorrhoids. If you're planning on taking some of these natural supplements that we're going to talk about, it's important to consult your clinician because some of these natural supplements can interact with certain prescribed medications. So I just want to mention that before we talk about those natural supplements. So the following natural supplements are going to be plant flavonoids. So flavonoids are going to be metabolites that are contained in plants, and some of the information we're going to talk about comes from this clinical trial entitled Clinical Trial of Oral Diosmin, or Daflon, in the treatment of hemorrhoids. So the first one we're going to talk about is diosmin. So diosmin is going to be a plant flavonoid. So remember, that is a metabolite found in a plant, and it's found more specifically in Citrus sinensis. So Citrus sinensis is sweet oranges. So this can include blood oranges or navel oranges. And diosmin has been demonstrated to have multiple beneficial effects that lead to subsequent improvements in signs and symptoms of hemorrhoids. And some of these beneficial effects include that it's been found that diosmin has anti-inflammatory properties through its inhibition on production of prostaglandins and thromboxane A2. It's also been found to have certain inhibitory effects on activation of leukocytes. These are white blood cells. It also reduces capillary permeability, and it helps to modulate venous tone. So this would be the tone of the veins. And another natural treatment I want to talk about in relation to diosmin is hesperidin. So hesperidin is another plant flavonoid also found in Citrus sinensis. And it's been found that hesperidin also reduces capillary permeability, increases capillary resistance, and has anti-inflammatory properties as well. And it seems to do some of these effects through inhibition on hyaluronidase enzyme. And the reason I bring these two up together is that flavonoids can act synergistically, meaning that they can have a combined effect that is even more pronounced than if they were only used individually. So hesperidin is usually going to be used in combination with diosmin. So a combination of diosmin and hesperidin is known as Daflon, and Daflon has been shown to have very beneficial effects on reducing the signs and symptoms of hemorrhoids, which we're going to talk about here in the next slide. And some of this information also comes from this article entitled Micronized Purified Flavonoid Fraction in Hemorrhoid Disease, a Systematic Review and Meta-Analysis. So sometimes the combination of diosmin and hesperidin can be termed micronized purified flavonoid fraction, or MPFF. And they're going to be combined in a particular ratio, and it's going to be 9-to-1 ratio, 90% diosmin, 10% hesperidin. This is going to be the normal combination that's used in the treatment of signs and symptoms of hemorrhoidal disease. So let's talk about some of those potential reductions in the signs and symptoms of hemorrhoidal disease from both diosmin and hesperidin, especially when they're combined together. One of the beneficial effects of using both diosmin and hesperidin together is that they have been shown to help reduce the prolapse of hemorrhoids. So prolapse is when the hemorrhoid becomes enlarged so much that it can actually pop out, and in some cases, in severe cases, it may require being pushed back in or may not even be able to be pushed back in the most severe grade. It's also been found that using diosmin and hesperidin reduces bleeding from hemorrhoids. It's also been found that diosmin and hesperidin use reduces discharge and edema from hemorrhoids. And then both decreased pain and decreased itching have been found with use of diosmin and hesperidin mix as well. So what's been noted is that when looking at studies, it's likely that it takes at least 3 to 4 days to start to have an effect. And especially at day 7, we start to see significant reductions in these signs and symptoms we mentioned here. So again, at least 3 to 4 days, but by day 7, we see significant reductions in these signs and symptoms. So I also want to mention that here as well. So some other natural treatments that may be used come from this randomized control trial entitled Flavonoid Mixture, Diosmin, Troxarutin, Rutin, Hesperidin, and Quercetin in the treatment of 1 to 3 degree hemorrhoidal disease, a double-blind, multi-center prospective comparative study. So Troxarutin is also a plant flavonoid, but it's found in a different source. It's found in Sophora japonica. So Sophora japonica is the Japanese pagoda tree. It has been found to have vasoprotective and antioxidant effects. And then with regards to rutin, rutin is actually the precursor to troxarutin. Troxarutin is derived from rutin. And rutin itself has also been found to be an antioxidant that also prevents platelet aggregation and reduces capillary permeability. So you can see that a lot of these plant flavonoids we talked about before help to reduce capillary permeability, help to have beneficial effects on venous tone, and help to have some vasoprotective effects. So you can imagine that all of these are going to be beneficial for hemorrhoidal disease, as hemorrhoids themselves are vascular tissue. And then both troxarutin and rutin may be included in a flavonoid mixture with diosmin and hesperidin as well. And then we can also see quercetin being added to this combination of plant flavonoids. Quercetin as well is a plant flavonoid. And quercetin is found in onions, apples, berries, tomatoes, grapes, and other fruit sources as well. And quercetin itself also reduces capillary permeability for vasoprotective effect. It also has immunomodulatory effects through inhibition of TNF-alpha synthesis in macrophages. So again, quercetin is going to be used in a mixture of plant flavonoids with diosmin, hesperidin, troxarutin, rutin. So again, we're going to see most cases of a mixture of plant flavonoids containing at least diosmin and hesperidin, with some other mixtures having these other plant flavonoids as well. And it seems that having these extra components may help reduce the signs and symptoms even more, or help to have longer term reductions in the signs and symptoms even after the supplement has been stopped. So in some cases, some of these findings can actually be still improved. So that's going to be very important for a lot of patients. So another potential reduction of a potential sign or symptom or risk of hemorrhoidal disease is a reduction in the risk of thrombosis. We mentioned thrombosis as one of the potential symptoms or complications of hemorrhoidal disease. So I also want to mention that here because I don't have it mentioned here. But the risk of thrombosis can also be reduced by these plant flavonoid mixes as well. And then with this larger combination, we can actually start to see reduced number of hemorrhoids as well. And again, as we mentioned before, the effects may be more significant, especially after longer term use with the mixture, and there may be even longer term benefits even after the plant flavonoids have been stopped. And there are some other potential natural supplements I want to mention here, and these come from the article entitled Evaluation of the Efficacy and Safety of a Compound of Micronized Flavonoids in Combination with Vitamin C in Extracts of Centella asiatica, Vaccinium myrtillus, and Vitis vinifera for the reduction of hemorrhoidal symptoms in patients with grade 2 and 3 hemorrhoidal disease, a retrospective real-life study. So I also want to talk about vitamin C. Vitamin C is also known as ascorbic acid. It's involved in important bodily functions. It has many different functions, including it being an antioxidant, it being involved in collagen synthesis, immune system modulation. It also has important anti-inflammatory properties. It also stimulates the activity of endothelial nitric oxide synthase, or ENOS. And by actually stimulating the activity of this enzyme, endothelial nitric oxide synthase, it actually increases nitric oxide, which actually reduces rectal tone and leads to reductions in hemorrhoidal associated pain. So vitamin C itself can have some beneficial effects in reducing hemorrhoidal associated pain as well. And then there are some other plant-based supplements that can be added to all of these combination of plant flavonoids we talked about before. One of them is going to be Asiatic pennywort, which is also known as Centella asiatica. This has been shown to have some beneficial effects in connective tissue repair. Bilberry extract is another one. This is, again, that Vaccinium myrtillus. This has been shown to have some improvement or some benefit to blood circulation. And then common grapevine, or Vitis vinifera. This has been shown to have some vasoprotective effects and helps with microcirculation protection. So all of these can help in the beneficial effects of a lot of these plant flavonoids we talked about before. So in combination, these can also seem to have some beneficial effects in reducing the signs and symptoms of hemorrhoidal disease. So in summary, these natural supplements have been shown to help reduce signs and symptoms of hemorrhoidal disease, especially in lower grade hemorrhoidal disease, so especially in grade 1 and 2, but we can even see it with grade 3 hemorrhoidal disease as well. And then in patients who have had surgical removal of hemorrhoids, a hemorrhoidectomy, these natural supplements have also been shown to help those patients as well. So there is some benefit in patients who have had hemorrhoidectomy. And in many studies, these supplements have been well tolerated and no side effects or very few side effects have been reported. I hope you found this lesson helpful. If you did, please like and subscribe for more lessons like this one. And as always, thanks so much for watching and I hope to see you next time.